Hello, hello.
Oh,
Welcome back, and thank
yeah.
you so much, dude. Thank you so much for doing this again. I
Well,
I was so upset when this thing crashed on me. I
yeah.
was like, no.
The city of New York, Boricua from the Bronx.
Dr. Paul Corona. I have a kind of a unique story. Well, I actually, I grew up, when I was a little kid, I wanted to be a doctor. I knew like early on. I even one of my nicknames growing up was Dr. Paul. And this continued through schooling, and I went to college I went pre-medical education at the best university in the country, by the way, USC in Los Angeles. And and after that, I went back east, and I went to New York for medical college, and got my MD there. And I didn't really know exactly what I wanted to do. I knew that I liked all aspects of medicine. I like OBGYN, I like pediatrics, I like psychiatry, I like adult medicine. So I kind of didn't really know. So I chose family practice as my specialty, because I thought, well, I can be kind of a well-rounded doctor doing a little bit of everything. So I did a 3-year family practice residency program in downtown Los Angeles at California Hospital. Um, and then I started practice, moved down to Orange County in 1993, and then I love being a family doctor. But what really I got me early on in my practice was when new medications started coming out, like new antidepressants started coming out, and I think most people have heard of SSRIs like Zoloft and Lexapro, Prozac. But there was a medication, a very important event happened in 1993. Is a medication called Effexor XR came out. It was the first medication that worked on serotonin and norepinephrine, meaning it balances those two chemicals versus just serotonin with what we call the SSRIs. And that's when I really started understanding that something was going on with my patients. I started to hear back from them that, oh my gosh, I'm doing so much better. They weren't having some of the side effects, that they were getting, like this, like with SSRIs, with medications that work on serotonin. You typically can get sexual side effects. You can feel kind of apathetic and kind of
I can attest to that, by the way. I
yeah.
can.
And so I started to see that, results were okay, and they were like better than nothing sometimes, or sometimes it made people worse. But when Effexor came out, I just realized less side effects, and I started seeing that people were feeling better as far as physically. And so people started telling me that, hey, doc, my head aches, my neck, my back, my stomach aches, my this, my that's better. And so I started to see this physical link, and I thought it's got to be the norepinephrine. I thought that's what's different about this medication. So I started seeing this over and over again, uh, to the point, and then I started understanding how to add medications like Wellbutrin. I started getting a feeling for these medications. Antidepressants, and some of them are called mood stabilizers. So I started to kind of try things out, and reading a lot of reading psychiatric textbooks and trying to figure out, why am I seeing these things happening? I'm not really reading about it, and I'm not really seeing other doctors doing it this way. So the 1990s were really a decade of discovery for me, of really exploring. And I think that it comes down to, we family doctors look at the body physically, but we don't really, pay much attention to the brain. And I think psychiatrists focus on the brain, but they don't really pay attention to the body. So as a family doctor interested in the subject, I was starting to see this mind-body connection happening, where I was starting to see emotion and the body connecting. And that to me was so fascinating, that about the year 2000 is when I decided to kind of switch over and give up my traditional family practice and move full time into psychiatry. And then that we can talk later about it, but that led to my first 3 books that took me 12 years to write. I then wrote 2 books for doctors since I want to teach, and then my most recent book, it took me 5 years to complete. But we'll talk about the books later. But that's kind of what what led me into doing this was that recognition early on that there's something magical going on, and just I kept exploring and trying and trying to figure out things, and that's what kind of led to me doing it full time, which is very unusual. I don't know any other family doctor who does what I do full time, and so, but I just thought I felt compelled to, because I felt that, it's something I had to do, because I was seeing that the patients were just dramatically getting better. I was seeing just much more satisfying results than being a traditional family doctor. And so that's why it kind of drew me into doing it full time, because I felt I had to.
Right. 100 years from now, we could have a school, right? In medical school, and they'll be like, and today we're going to talk about the Corona method, right? Back in 2024, on a podcast, Dr. Corona spoke about the mind-body connection. Years later, we have come to discover that he was years ahead. You know what I mean? I could see that happening. I take medication, and I was taking Lexapro for anxiety. And it helped with the anxiety, but it started to give me problems, completing, being able to finish. I mean, like, I just, for the life of me, I couldn't. And you would feel like you're about to, and then it stops. And it's very frustrating, obviously, it wasn't fun. And then I moved to a different medication called Pristiq. And since I moved to Pristiq, it was because of the side effects, by the way. They said that this will not affect that side effect, will not give you that problem. And, I can, I can complete now, which is great. And you mentioned the connection to the physical pain. I have herniated discs on my neck that I've been in physical therapy for like 4 years. And recently, I've been having less of the really bad flare-ups. Now, I have been in PT, right? Now I started with a new guy who's really thorough. So my range and everything has improved. My posture's improved. There's been improvements, but I kind of started the medications in parallel. So it's hard to say what's really helping, but every time I come out of his office, I feel way better. So I know he's helping. He's giving me great exercises, but I never connected that the psychiatric medication could be helping. Particularly, you mentioned norepinephrine, which is works with Pristiq.
Right.
So it would help with physical pain, like this pain that I have here that goes up to my head because of the nerve being pinched, can be addressed with this.
Well, absolutely. And that's why I started seeing things like that happening. Well, Effexor was the first medication that came out in that works on not only serotonin, like what Lexapro does, but also norepinephrine. But then came Cymbalta and then Pristiq. So Pristiq probably the one I've been working with the most over recent years, which is basically the same company that made the original one, Effexor. When Effexor went generic, they came out with Pristiq. But yeah, this is the kind of thing. What's happening with you is what's happening with a lot of my patients. And like one guy, I talk about my recent book, and he was going on his 4th back surgery, lower back surgery. And I put him on Effexor, like this was like 30 years ago. I put him on Effexor, and his pain went away, and he ended up canceling his next back surgery. And he didn't get it. He came in with his MRIs, and they say, "Look at this. My discs are this, and they're." And I go, "Yeah, but those poor nerves have to go through that mess there, that scar tissue and the stuff that's there." I said, "What's going on with Effexor is it's actually working to balance the chemicals inside the nerve, so it actually works around the blockages even, and so that's why your pain's so much better." And so yeah, so even to established pain that people have, that even with x-ray showing things or MRI or whatever, doesn't matter, it can still help. Or another one, irritable bowel syndrome, a very frustrating problem, because people say, well, my gastrointestinal doctor can't find anything, or I did all these GI studies and everything come out normal. or fibromyalgia. Oh, well, on my blood test, it's not an autoimmune problem. My blood tests are normal. Well, all these things that you can't do a test for, well, you can't do a test because it's a microscopic problem. It's a microscopic problem in the nervous system, and that's why you can't test it in traditional ways. But it doesn't mean that the fact that we can't see a test with the naked eye doesn't mean that these medications aren't working, because they do dramatically.
Is there a simple way to explain why a pinched nerve, like what I have here, that causes, like, I've woken up like this sometimes with my fingers, because they're just from is there a way to explain in a non-medical way that most of us will not understand how psychological medication helps fix that?
Well, it's not fixing the blockage. It's actually helping the nerves to flow better. So basically, the best way of explaining it is it's working around the kink. It's working around the blockage, because what happens with the blockage, it slows down the flow of the neurochemicals. And and let me just explain explain to the listeners how this works. It might make more sense if I explain it this way. So the nervous system, if we look at it, which is the brain and all the nerves that go everywhere through our body and to the fingers and toes, everywhere, has nerves attached to it. So there's if you look microscopically, there's over 100 billion nerve cells we call neurons, and they connect to the next cell through we call it synapse, which is a space in between the cell. There's over 100 trillion of those in the body, and each cell connects to at least between 1,000 to 10,000 other cells, one cell. So there's this constant weaving network, and then the chemicals travel around the body about 1,000 times a second. So what's happening at the cell membrane is that leakages can occur that cause the chemical to be thrown out of balance. So the chemicals really I focus on are serotonin. We talk about norepinephrine, and we just talked about dopamine, which we haven't yet. GABA, which is another one that's key. So the chemicals should be moving in a forward one-way direction, but sometimes certain receptor sites on the cell open up and causes a backflow, or a backflow of chemicals that they start going the wrong way. So we call this neurochemical imbalances. So why do they go out of balance? A few reasons. Genetics causes it. So a lot of people, it runs in families, and that's why when we talk about anxiety and depression and things like that, it runs in families, and so it can be affected by changes in hormonal status in the body. This happens more with women. Situational stressors, trauma. So certain things throw off the flow of the chemicals. So what medications actually do is they attach to the cell membrane and fix the leak. So you mentioned Lexapro. So we call a selective serotonin reuptake inhibitor. It's inhibiting the reuptake of serotonin because it attaches to the serotonin site, and it forces serotonin. It prevents it from going backward. It forces it to go the right way. With an SNRI like Effexor or Pristiq, it works on serotonin and norepinephrine, and it blocks the backflow, forcing them to go the right way. So it basically is reconnecting these chemicals in the right direction, and it keeps them from going the wrong direction. And that's what happens. So when you start to see the flow of the chemicals improving in the system, then basically it causes throughout the body everything connecting better. And then when it comes to pinched nerves and kinking of the system, the chemicals flowing can go through, and it works around those blockages. So everything works better, and then we just have to figure out which chemicals are out of balance, which medication to use for that. And that's where I kind of come in to by taking a history and listening to patients. I have an idea. I think it's serotonin. I think it's norepinephrine. I think it might be GABA. So I'm able to kind of figure it out as we go along, and try to. And it often takes a combination of sometimes 2 or 3 medications together to get the best results with certain patients. Hopefully that's not too complex. Um, that's kind of what's going on is medications basically normalizing the system. And when we normalize the system, not only about pain, but people will say, I haven't felt this good in years. This is the old me come back. I haven't, this is how I felt before I had anxiety. This is how I felt before I had depression. This is how so that what I'm looking for is that real person coming out, is that the person that's been hiding and the person that the person is meant to be, but the problem is when these neurochemicals are out of balance, the person can't get to that state because anxiety, depression, or whatever the case may be.
At what point do we know that everything's in as it should be? Like, for instance, my depression and all that stuff goes back to childhood, right? So I don't quite know what being good is. Same thing with my teeth. I'm driving my orthodontist crazy because I don't know what a proper closed mouth feels like. So they're like, we're done. And I'm like, but this doesn't feel right. So I don't know, like I'm taking Prestique and I take Trazodone for sleep at night, right? But I don't know if I'm there. I don't know what good feels like. How can we tell? Because you mentioned they're super tiny and you can't really test for it. So how do you gauge, like, how do we say, okay, Angel, this is where you belong? Or
you're not there yet. I'll tell you right now, or else you'd know the answer to that question. So there's two things I hear. We call it remission in the field of this field. We call it full remission. Remission means one of two things. I'm back to the old me, and then when is the old me? It's either usually childhood, because sometimes people say I felt pretty good when I was a kid growing up. So basically, when things reconnect properly, people say, I feel like this old me from my childhood. I feel carefree now. I feel like, so people, when I ask them when did they feel the best in their lives, because I always ask my patients that question: when do you feel your best in your life, and are you there yet? So people will say either elementary school, that's before puberty, or maybe late teens, early mid 20s, because of the fact that out of the house, new in career, before marriage or kids, usually before life gets more complex,
crushes the spirit.
So, but that's where, so if someone can say to me, this is the old me back, I feel amazing, I feel great. I haven't felt this good in so many years. That's a good answer. That means we're there. Or, someone says, I don't think I've ever felt great, even since childhood. Okay, well now with that person, I'm going to try to explore to get you to that state where you now understand, like, oh my gosh, I never even thought I could feel this way. But that means we're there. And if someone says, I'm not sure I'm there yet, that means you're not there yet. It means that, Trazone's fine, but we probably could do better than that. But it's just a matter of combining things. Sometimes I'll add Wellbutrin, and that'll give people more energy, more motivation and drive. Sometimes I'll add Topamax or gabapentin, and that can get rid of the rest of the pain. That can help with anxiety more than just Prestique alone. So I look at the different neurochemicals and think, I think we're not there yet. But I keep, every patient I see, I keep pushing and pushing until that person says to me, I'm exactly where I want to be. You got me to a place where either I never thought I would get to, which is a great answer, or I think you told me I get here and I believed you, and you're right. I'm there. I can't believe I'm back to where I was. And so that's I want to get people back to that state where life is amazing every day. We all have stress, but we're at the point where I get through stress well, I can handle things better, things don't get to me the same way. That's the state I'm looking for.
So it's not just like for me, and I'm going to keep referencing to myself because it's the best.
Right.
This year I started having panic attacks. So the best reference I have at the moment from I was not having panic attacks to I'm freaking out to now they got me back to where I'm not having the attacks, but I don't know that I'm where you're describing. But I don't even know how to gauge that. Like I don't even know what does happy mean, right? Because I don't know, I don't have a thing to gauge it against. So even if as you're describing this, I'm wondering to myself, like, using myself as an example, okay, I was really bad with the anxiety attacks. I can't lay down to sleep because when I lay down, I feel anxiety, and that's where the trazodone comes in, right? Um, so we got me kind of baseline to where I was at before the anxiety attacks, but that place still wasn't a good place. So I don't even know what I'm looking for. That's where I'm kind of struggling. So as I'm hearing you say these things, I'm excited because of the promise of that potential place, but I don't know what that is. So like, what would I feel? Like, are you feeling that right now that you describe? Are you in that place?
Oh yeah, and I think a lot of people are, and there's a lot of people who don't deal with these issues, and they just feel good, and but but the fact that you're not sure means you're not there. Because if you were there, you'd be sure. But so the best way of explaining it to people such as yourself is better than you can imagine, better than you can even, or I mean, was there a time in your early childhood that you felt really happy and a happy kid, and was there that time in childhood for you?
If there was, it's very, very buried. Um, as far as I can recall, it's been chaos. So my earliest memories, um, are chaos, like being taken in my underwears to someone's house because my parents are fighting. You know what I mean? Like it's all I don't have they I could tell you this. In my life, I recall two moments where I felt at peace. Hey, what the hell? I got balloons. You saw that? What the hell did that come from? Is it from the peace sign? What the hell was that? Freaking balloons popped up. But what the hell? In any case, there was one time when I finished taking a bath. I was in the Bronx and I went into my room. It was dark. The temperature was good. I laid down. I was playing This Is Dedicated to the One I Love by the Shirelles. And for that moment, that brief moment, I felt peace. Actually, maybe there's three. Um, the second one was when I went to Puerto Rico. I went to Puerto Rico and I laid down in that bed and it was so comfortable and the pillow was perfect, the blanket was perfect, I felt peace. Um, and at an event recently with my wife, we were holding each other and everything got quiet and I just kind of felt at ease. So it's like those are the only moments that I could think of where I almost felt at ease.
Yeah.
And I and even then, I don't know that that was what you're describing. So now I want that.
And you get that, but see, a lot of people say, I had a kind of a chaotic childhood, and I mean, some people who have like really great childhood memories because they have really functional parents, and there was a few free from any significant abuse. Some people say they can remember that time, and then things change in middle school because of puberty, and then things kind of change later. That's when emotions start changing during middle school typically. And then, but yeah, there's some people have a really Mayberry kind of childhood where, really everything is so functional. That's a good place to get to. So that's one thing. So again, some people it's 20s, sometimes it's not 20s. So I kind of try to find that place. And then when I'm asking later, I say, hey, remember, let's go back to what you said before. Are you at that place yet? But I mean, I don't stop treating people until I'm very aggressive too. The Corona protocol is a very aggressive method of doing things, and I push. I don't wait around. Oh, we'll do this, and then a few months later we'll try that. No, I'm doing things right away. Every week or two, I'm making changes. I'm making dosage changes. I have people call me in between appointments to make changes. So I work very quickly in order to try to get people to that place within usually 2 visits to 3 at the most. That's my
Wow.
goal, to get there really, and I'm able to figure it out really quickly. And this is based on, over 30 years of experience doing this. And just kind of knowing by listening to people and listening to their stories and listening to their symptoms, exactly what's going on and how I can help.
I don't want to knock any of the folks I've been working with, but it's been months trying and trying and trying and trying, and again, not trying to knock them, not trying to crap on them, just stating a fact.
Sure.
Their approach is less aggressive, more conservative, where they're like, well, ideally we get you balanced and then you can stop taking the meds and, get you to a place where that's, you're back to who you are. But that's not what you're describing. You're not what I was before before the MRI broke me, right? That's what I say. The MRI is the place that created that, that's what broke me. I went in, I freaked out, and I've never been the same since. But even before that, I wasn't at this nirvana you described.
Right.
And now I'd like to understand, at least feel that once in my life, you know.
So like I said, a lot of doctors just like very like, oh, we'll try you on Zoloft and then we'll give it 2 or 3. Well, so there's notion that it takes things like 6 to 8 weeks to work, which is nonsense. Oh, if that doesn't work, we'll try Lexapro. If that doesn't work, we'll try. They're doing the same thing over and over again, and they're waiting months at a time for something to magically happen, which it doesn't. So that's why there's a lot of wasted time, and the problem is a lot of people drop out of treatment. A lot of people just say they give up, and like thankfully you hung in there, but there's a lot of people just give up and say forget it, it's not working. And the thing is that once they give up, they may never ever go back and try again. So that person may be lost to treatment forever for the rest of their lives because of the fact that the doctor wasn't aggressive enough and didn't explain to the person, look, this is the process, I'll figure it out. You guys,
That is so key to what you said right there, the explanation, letting them know, because that's the only reason I gave it a shot. I didn't want to. I didn't
right,
want to take anything. I didn't want to take Lexapro. And I was reading about it on the internet, right?
right,
So I was going to Dr. Google, working on my MD degree
right,
and becoming an expert on all these things as
yeah,
per Google. And that made me really scared, you know. It terrified me to take any of this stuff, but I eventually accepted it, and I'm better, but I'm not where you're describing. And I really, I'm definitely, as soon as we're finished, I'm sending your staff an email to set up an appointment because I want to find this place. And like I said, I recently had an appointment where they switched me to Prestige, and he's like, let's check up in a couple months. Like
yeah. But again, we got to be more aggressive, and I
is
think
it
people.
safe? The
Oh,
aggression?
Oh yeah, absolutely. Totally safe. All these medications I work with are extremely safe. And what I do with my patients is explain, if I draw out neurons and I explain what I'm doing and what medications are working. If the person's in my office, I'll draw it out and do some teaching. But yeah, no, totally safe. And again, if something doesn't work, we stop it. We try this. We try a little bit of that, and pretty quickly. And I normally choose very well, and normally I can get people to that place, usually within 2 3 weeks at the most, month or two at the most on the outside, so
That is that
much
is
quicker than people would imagine, for sure.
I've been at it 5 months now. And I'm baseline, right? You know what I mean? I'm baseline. I still need trazodone to be able to lay down. If I try to lay down right now for a nap, I'll feel the panic kind of come up and I have to get up and I
Yeah,
have to wait until night and I pop the trazodone and then I can do it.
right,
That's not good. I want to be able to take a nap.
exactly.
Would I be able to take a nap if I get to this place
Oh
of
yeah,
magic and wonder you describe?
yeah, 'cause you'll be sleeping better at night, and yeah, just everything. I mean, everything will be more at peace in your system, and also any kind of residual pain that may be going through. I'd be shooting for like gone, even if you have to go through physical therapy for one thing, where your pain is really at a minimum, and all these are due to just balancing your neurochemistry properly. That's it. That's all we're doing. And again, I think the biggest problem to get through with people is stigma. Is like, oh, I don't want to be on a bunch of pills. I'm not a pill person. I rarely take Advil. Or there's people who have a really hard time talking into this, and a lot of times it's because of this, this anti-pharmaceutical mentality. I don't want to support big pharma, and they're all that. So I think it's just a matter of getting through to people like, look, these medications are safe. They're not, all they're doing is rebalancing your system. So it's just explaining people what's the process of it. And sometimes I have a hard time getting people to do things, especially men. Men are much more difficult to convince. Women are a lot more open to things typically. But I think if someone can just take a leap of faith and say, hey, there's nothing to lose here, or there's a lot of potential to gain, and let's go for it.
Yeah, I'm one of those people. I didn't want to be, and I hate to use terms like that, but I didn't want to be a pill junkie. You know what I mean? I remember seeing my mom taking so many pills, and I never wanted to be that way. Like I never wanted to be that way, and I've had no choice. Even with the blood pressure, since I was a kid, I had high blood pressure, and as I got older, it just got worse and worse and worse. And they're like, well, if you don't take them, you're gonna have a stroke, or I lost a friend to that. She refused to take them, and she had a stroke and she died because she wouldn't take medication. She wanted to do it naturally, and I did too. But I also wasn't stupid. I ended up in the hospital, and they're like plugging all these things into me, and they're like, "Hey, man, you're like in a really dangerous place right now." So I was like, "All right, you know what? Let's pop them pills." You have written books about this all as well, right? You have them for people like me, and you have them for doctors. Can you talk about those as well?
Yeah, so when I switched my practice over around the year 2000 or so, after a couple of years, I was starting to think, I'm seeing that there's miraculous results, much more miraculous than any books I'm reading. I'm not seeing other doctors doing it the way I'm doing it. So I decided, I said, no, who's going to believe me? Who's going to believe this family doctor? So I said, to be taken seriously, I need to write a book. So I started writing my first book, and then I had so much to say that I ended up with 800 pages of material. So I thought, okay, well, let me split it into two books. So I released my first book after 4 years. And then I said, okay, let me just work on my second book now. So the second book ended up being another 800 pages. And then I thought, okay, let's split it into a third book now. So it's 3 books. It's called Healing the Mind and Body, the trilogy. So it's a 3-book set. It's about 1,200 pages total. But it's really, I go over the science. I explain in detail, like I did with you right today. But also, I have a lot of diagrams to explain things better. I have chapters on everything: pain, addiction, anxiety, depression, everything. But yeah, and then the third of the 3-book series is probably more for doctors. Maybe a lot more detail, like things that doctors to keep in mind. But I had a lot of patients tell me they like the third book too, because they say that it kind of helps them to see how doctors think and make decisions. And then after that, I wrote 2 books. I want to teach, so I wrote 2 training manuals for doctors. So I want to set up that hopefully in the near future, an online training course for primary care doctors, for physician assistants, nurse practitioners, to learn the Corona Protocol method. So the book 4 is the Corona Protocol Prescriber's Guide, and book 5 is the Corona Protocol 3 Secrets to Success. And then I started about 5 years ago writing my current book that just came out a few months ago. So this one's called the Corona Protocol, a scientifically proven medical solution to stop addiction, bullying, homelessness, school shootings, and suicide, 30 years in the making. So this book I wrote recently is, well, it took me 5 years, but it's actually a storytelling book. So it's totally different than my first books. I basically tell 30 original short stories about people. My first chapter is on anxiety disorders, and I tell 2 stories about people with anxiety. The second chapter is on depression. The third chapter is on bipolar disorder. Fourth chapter is on ADD. So I just
These are true stories. Sorry, they're real stories.
some of them are based on patients I've seen, at least parts of the story. There's not really one story that's fully of one of my patients, but I have
Gotcha.
I have bits and pieces. A lot of it's my imagination.
Mm.
But I cover a lot of topics, and I talk about the topic briefly. I refer to my first 3 books if people want to read more detail. but then most of it I try to like focus on the storytelling. So it really came out well. I have a 5-star rating on Amazon, and it's selling really well. And so yeah, this is my probably my last book for at least a while. I've been writing now for like 23, 22 years now to get the 6th book out. And but yeah, so the Corona Protocol is going to be really going to be my my teaching methods. And you know, in the book I talk about the cases, and I talk about how to Pristiq, and how to add Wellbutrin, and how to, so in each of the stories I talk about medications, the role of them, what I did with each person to kind of explain why I would choose a certain medication for this person. So if you read those stories, a lot of people will say, well, that I completely understand now why you would need to add a combination, because of that person's story. The way to get the person from here to here was, there was a process for me to do that. So, and that just, the stories are very real life, even if they're not all true stories, they're very real life stories.
Right, right. Well, you can build stories based on your experience and the things you've seen, and still tell tell a very accurate telling of the situation, based on experiences. Um, I tell you what, this is all very exciting for me, because I'm hearing all this and I'm thinking, wow, there's a better place, you know, there's a better place. Like I I kid you not, I'm definitely making an appointment because I want to explore this. I mean, it's just like with my counselor, right? You try different people until you find the right one. I've been through 2 so far. I had one when I was a kid, that helped me a lot. The second one that I found reminds me of him. It's a female, but she reminds me very much of my childhood counselor. So it's a better fit, you know. Um, I think the doctor I'm working with is a good doctor. I don't think he's a bad doctor. I just, it takes a really long time. And if there's a faster way to get to a better place safely, of course, I'm totally open to it, you know.
Well, most doctors, not that they're not good and bad doctors, because a lot of doctors just don't have the training and expertise, or their training program. Like for example, primary care doctors, like family doctors and pediatricians, they don't get a lot of it in training. And I mean, they get some, like I got some in training, but not a lot. So most of it I really taught myself. And most doctors, they do things like they did in training. They don't really change things very often, and they just do things that feel safe to them. And so they're not necessarily bad doctors. It's just that they don't know, they don't understand. And so that's why where I come in to explain, like, that, don't just be, where I am with patients, don't just be satisfied with, oh, I'm doing a little bit better, when you can be doing a lot better. But they don't know how to do that. They don't know how to get you from this stage to that stage, because that's just not what they do. And then if they say, well, I don't know what to do, so I'll send you to psychiatry. Well, the psychiatrists don't really often know what to do either. They're not really that much better often at doing this than the primary care doctors, in my opinion, or from what my experience is, because they don't understand also how to combine things in certain ways. It took me a long time to figure out, how to do that and what the whole protocol is. And it's not taught. I mean, I've looked at books and journals, and it's just the way I do things is not taught the way I do them. I had to really learn a lot of it on my own, and through a lot of trial and error, but now I got to the point where it's really fine. I can really fine tune things and get people there really quickly, because what I do is, even in between appointments, I have people call me, and so every new patient I see, I have them call me in a week and say, hey, how's this going? Because I can tell within the first week if I'm on the right track with something. And if not, I change it. So I do a lot of like in between visits, and I return every phone call, so I'm also very available, and we have really good customer service here. So people can always get a hold of me quickly and easily, and I also make quick changes. But I'm able to, like I said, with just being in really good communication with patients, it doesn't take me more than 2 visits to 3 at the most to get you to that best place. And that's my goal always with every patient.
That's amazing. I mean, excites me because if there could be better, I want it. Do you take insurance or you private pay? Like what's the setup there? Um,
We take some insurances. We take Blue Cross. We take Medicare. We take TRICARE, which is the military insurance. Most of the time it's cash, but my rates are actually very reasonable for what I do.
right, right. And you figure if you do the math of like 3 visits, right, whatever your rate may be, to 15 visits at the insurance rate, you know,
Three visits for less than $500 for all 3 visits.
right, right.
And so
Yeah,
that's a good deal for me to to get for people from A to Z, and then maintaining that. And then sometimes I have to tweak things along the way, and sometimes things are good, but I have to adjust doses of things. But that's all I do all day. I'm always like working with meds and tweaking the dosing, and and again, it's also trying to balance the positive effects without side effects, and there's always that balancing act with medications. But yeah, it's amazing the results I get. People are every day I hear it, and this is what has driven me to do it full time, is that I wasn't getting the same satisfaction being a family doctor. I liked it, but it was more routine. It was more just this is so much more creative. This field of medicine, I feel like I'm making a bigger difference in people's lives than I was before. And so that's what keeps me going. That's what keeps me writing. Now I'm soft. I mean, after this book, now I'm going to take a break from writing.
yeah, it's a lot
Uh,
of years.
yeah, but all my books are on Amazon. This current one is on Amazon, Barnes and Noble, and Walmart. But I'm really happy with how it came out. I'm just getting rave reviews about it, and I think I mean, all the books I have, I think are good, but I think this is my best book, yeah, so far.
Yeah, I have it in my shopping cart
Yeah.
on Amazon for my next purchase. I'm gonna push it to my Kindle. Um, I was looking at it, I'm like, all right, I'm gonna pick this up. I do buy books when I'm trying to support the person. When I want the person to get because it counts towards your stats. When it comes to making that transition from family practice to psychiatry, is that something doctors can just do, or does it require cross training or
It would for most doctors it will require training. It's not going to come. So that's why I wrote my fourth and fifth books, which aren't out yet. I finished them, but they're not released yet. I'm waiting on those. But I think doctors still need to get trained. It's not going to, and so that's why I'm setting up this course that doctors can read these 2 books, and what I want to do is teach in the kind of in the way I did this most recent book with actual real people, and then following real people, on my along on the web, on electronically, to kind of follow people along with the other doctors, and then hey, let's follow up in 2 weeks with this person. So kind of like an ongoing clinic. We can be doing an ongoing clinic, and then teaching in that way, because that's to me the best way of teaching this would actually be on real patients and explaining, okay, here's why I'm doing this. Let's see how this works in 2 weeks when they come back for a visit or for a check-in. And so that's why I think the best way for me to teach. But I think hopefully when this book is doing better and better, and then there's going to be a demand for me to do the teaching.
so it's from a simply work standpoint, it's something a doctor can just do. So like you didn't have to go back to med school for psychiatry. You could just say, you know what, I'm gonna change the type of medicine I practice, and you're able to do that. Like, is that
Yeah, and as a family doctor, we have the luxury of doing that. I mean, we can, I know other family doctors that specialize in other things. Yeah, as a family doctor, you have that, you can do that. You don't have to do a psychiatric training. I mean, so you can, and there is actually programs out there, which is primary care and psychiatry, like dual training. Those are now available across the country. I don't feel like I would need to take that because I just really have done the work that I need to do to get the results I see. But I think that's an option for people. But I think another option is just taking my course and reading my 2 books there, because I detail exactly these books are definitely more for doctors. They're very specific, very detailed
You
about
mean
how
4 and 5, book 4 and 5, those? Okay.
yeah, they're very detailed, very specific. And so I think I think to me, I think it would be maybe a better training, more cost effective than doing a whole 2-3 years of residency training. So
Oh,
not that
that's
that would
interesting.
not that that wouldn't be a potential good thing. Especially, I think that would be a good thing if a doctor is just coming out and they're coming out of medical school and they want to kind of do primary care and psychiatry. Well, they have these 4-year training programs where you get dual certified, and that's definitely an option for a certain doctor. But for a doctor like myself, out in practice for 32 years already, I don't have the desire to go into a training program. you know,
Yeah, yeah. No.
I think I'm big on that.
Yeah, yeah. Okay, I see. I I didn't know that you can kind of just switch fields. I thought that whatever kind of doctor you became, that's it. You're just that kind of a doctor and you're very like licensed to just do family or that I didn't know you can,
The
you know.
vast majority of family doctors do exactly what you just said. They never ever veer off the course. But there's the very rare doctors like myself. There's another doctor I know, and she basically specializes in migraine headaches, and so she basically focuses her practice on migraine headaches, and so that's great. Instead of being a neurologist, or becoming a neurologist by training, she, as a family practice doctor, was so interested in migraine headaches, and that's all she does. And so yeah, so you have the luxury in being a primary care doctor to do that, but it's just not done very often. Probably 98% of doctors just do exactly what they're trained to do, and never veer from that. It's a very much of an unusual doctor that would, I don't know any doctor that has done what I've done. Is there one out there? Or maybe I don't know. I just never met the person. That's all. But I'm sure there might be some doctors out there who only do psychiatry after being a family doctor. But again, I haven't run into that person yet.
That's it's fascinating. Um, I don't think I could have done medicine. I'm, too uh well, certainly not good with blood. I mean, I have to inject testosterone twice a week, and that took. I mean, I had to summon the power of Zeus to stop my hand from shaking, to do it. And I had no idea how I was going to do this when they first say, "Hey, your testosterone's like a 90-year-old man. We got to do something about that." And I was like, "God, I'm terrified of needles." They used to have to tie me up on a Velcro strap in the doctor to take my blood. Like I would legit fight, like I would fight you if you don't like, I would fight you. So how am I supposed to stick myself? And somehow I managed, because I mean, I realized I have no choice. I can't afford the beads that they put inside you. You know what I mean? Like these little beans or whatever. Like it's too expensive. They cut you open every 3 months. Like it's probably easier to just do the damn needle. you know. So I've been doing that, and I accepted the medication, um, and I'm working on it. Do you, is it okay to ask? If it's not, you could just not answer. But did you or need to take any of these medications yourself to get things in order, or you're just there, like you just already feel
I have.
good and
Yeah, you'll read about that if you read in the book. I read about you read about my story too, and yeah, I've had issues too, and I take meds too. But yeah, I don't want to ruin for the reader what
no,
you're
no,
gonna
no, yeah, don't spoil it.
have. It.
No spoilers.
The answer is yes.
Oh,
So
okay.
I know. And then some people who've read the book say, now I understand why you have such a passion for the subject, is because you've been there, and
Mhm.
you've seen for yourself how things can get, and how things, and so yeah, so that's, I think it maybe that's one of the reasons I got so interested in the subject, because um but yeah, I think I've been interested in the subject for so long. Like I said, for over 30 years, I knew that I liked it. That I didn't realize when I first started practice that it would be my whole practice. I just thought, I'll just work that into my regular family practice. But then during the 90s, like I said, when Effexor came out, and then I started understanding Wellbutrin, see Wellbutrin adding to that Effector Pristique boosts energy, motivation, sex drive, happier, more positive. Topomax is working on GABA that can reduce anxiety, reduce pain. It also helps people with weight loss because it reduces appetite in the evenings, reduces stress eating. Sometimes, there's some people have a bipolar element, so I add like a mood stabilizer, so it's just all these, just constantly individualizing. And sometimes I don't really know going in what the final diagnoses are going to be until I actually explore and get a kind of feeling as we go. And so that's why, I've just gotten really good at knowing what to do when and when to add up, based on I take a very detailed history. I look at every possible every symptom. I look at your past. I look at family history, and after I take a detailed history, then I'm able to figure things out fairly quickly after that.
Is it possible that gabapentin or edibles could have contributed to my breaking at the MRI? Because I was taking GABA for pain.
Oh, you were taking it then? Okay.
Yeah, they gave me that to try it for nerve pain.
Yeah.
And I was taking edibles to try and numb the pain. So I think when I went to take the one that started the breaking, because it was 2 MRIs, one that I was able to complete, but I had to take a couple breaths, get out of it, take a few minutes. And then there was a second one where I said, if you put me in there again, I'm going to break the machine, but I was taking GABA on the first one. I also had a lack of sleep. I was rushing. I was super, panicky as I was trying to get there on time. Could those two things have contributed to that? Because I'm terrified of GABA now because of it. I think I don't know if I still have a bottle of, I don't remember. I have Wellbutrin.
Yeah. Did that help?
Well, he was gonna have me take it with Lexapro to help the finishing situation.
Right.
But then he switched me to Pristique and he told me not to take the Wellbutrin, just to take the Pristique. But I have a brand new bottle in there that he gave me he said it's the lowest dose or whatnot. But I didn't start it because he told me not to,
Well, Pristique, Wellbutrin, I call the dynamic duo of medications. What was your experience with gabapentin? Did it help your pain?
I don't recall it helping pain, to be honest. I really don't. I don't recall that I took it exactly as it was required. I was probably taking, like if it says take three times a day, I might have been taking 1 3 times a day, then 2 3 times a day. And I don't know that I ever got to the 3 because I never felt anything.
Right.
And as we established, I was very against medication.
Right.
So it's hard to say if I gave it a fair shake.
Yeah.
But I didn't feel anything, so I just stopped.
Yeah. So that's what I mean. This is the kind of stuff that we'll talk in really detail about everything you've tried, everything, each of your symptoms that aren't completely resolved. See, I'm like I said, I always go for a home run with patients. So the home run is like, man, I can't imagine. People tell me I never thought I'd feel like this ever, or are you kidding me? People actually some people feel like this without taking anything. Yeah. I think there's a lot of people. These things are so common that I think, there's so many people in this country that aren't treated that should be, and then if you think about this country, how about around the world? If you want to go bigger picture, think about how many people are suffering around the world that have no access to this kind of stuff at all. There's no option of ever taking things like this. So they just suffer. A lot of people just suffer, and it's too bad because there's answers, but they're maybe living in a part of the world where they don't have those things available, just modern life is difficult and they don't have these kind of things going on. And so, and even in this country, most people do not have access to a doctor who understands this. And so all they know is Lexapro or Zoloft. And then some of them stay on and go, well, if I don't take it, I feel worse. And if I take it, I have the side effect, but oh, well, I guess I'll just have to do without that. Or I guess I'll just have to, no, there should be no this or that. It shouldn't be this or that, because there should be no residual side effects if we do things right at all. And so, but again, there's the most
Take
people.
everything, but you cannot take sex from me. You know what I mean? You can't take that one freaking piece of joy that I get in my miserable existence from me, you know? You
Got
can't
it.
take that one from me, you know? No way.
Yeah.
You know, would this kind of also help with like if you have performance anxiety at times? You know what I'm saying? Like um
And even for there's performance anxiety and there's premature ejaculation too, where it's the opposite problem, where it's just too quick, And so yeah, so these can definitely help with that. I mean, there was actually something like Lexapro, believe it or not, can help slow things down, and maybe a positive thing for
oh,
certain people who have
for the
premature.
premature, right,
You
right.
So that actually might be a good thing where we want to try to fine tune it where they can still finish, but they can last a long time and get the best of both worlds. So that's something that would be, and then also performance anxiety is real too.
Like if you
And
get nervous, you know, or something like sometimes, I mean, again, I'll use myself as an example because you know what, there's no shame in this, right? You know, sometimes you're in the middle of it, you have an intrusive thought and you know what I mean? Um, could that help with that kind of thing?
of course, absolutely. And then the problem is if that happens once, and oh, it's not you, it's me, and see, then the problem is that happens once for a guy, it gets into our head, and then
100%.
all of a sudden going into next time, you're already like thinking, oh shoot, I hope this doesn't happen again. It happened last time. So already you're going in with anxiety. And then what if it does happen again? And then you're thinking, oh my God. So I've had this happen with guys who are in their 20s and they're thinking, oh my gosh, it's happening to me and I'm only in 20 or early 20s. And the problem is, I said, it's gotten into here. It's gotten into your head to the point where now you're overthinking it. And
Right.
now but these medications can help break that cycle really easily.
Wow. So you've had people come in and talk to you about that stuff? Like,
Yeah, yeah, and I'll talk real with people. I'll say, hey, look, hey, we're guys. Uh, so I said, we're guys. We can talk like guys, and I'll ask a guy like that. I said, when you're by yourself, is it a problem? And most of the time, the answer is not by myself. By myself is not a problem. Right there, it tells me something a lot. That tells me, okay, well, it's not a functional problem then. It's just
right.
situation of being with someone and the stress and this performance anxiety. So that way I know it's not a problem that can't be fixed. It's just we have to just get to the anxiety part then in that situation.
Yeah, well, I noticed even like if you take Viagra or Cialis or any of those things, even like you will get rock, and then that thought or whatever happens is gone just the same. Now it'll come back a little easier, provided that there's the effort made. But
Right.
I realized that and I was like, okay, you know what? That when that is happening, it's up here. So I have to really like clear my head, like not let that. And that's the hard part because it's just exactly like you said. If it happens once, then you keep thinking about it and you want to be with your partner, but now you're
Right.
thinking, damn, I hope, the good thing about, at least for me, is that I always would hang on for their multiple orgasms before it would happen to me. So at least, they're taken care of, right? And she's good. You know what I'm saying? At least like it's not like, I can't. At least I'll get her 3, 4 times, and then before I can finish, intrusive thought, and I'm like, oh, it's that Lexapro. But it's up here. So, you
Yep.
know, it'd be nice to address that too. It's under control, but it's something that if it could be eliminated altogether and even just lay down and go to sleep. I keep using myself as an example because it's all I got. You know what I
Yeah.
mean? I can't really talk about other people's stuff. My mom has stuff that, hell, I maybe as soon as I get a job, because I'm unemployed at the moment, I've been trying to get a job. When I get a job, I'll be like, Mom, you got to go see this guy. Because there's a better place, Mom. because she's also been taking a lot of stuff and struggling, and you know,
Yeah, but
hell, you know
people,
what I should do? I should send her first,
yeah, but
prioritize her over me.
not you. I think a lot of people are taking things and they're still struggling. Well, they shouldn't. You shouldn't be struggling if you're taking the right things. Then you shouldn't be struggling. I mean, sometimes people are taking too many benzos and they're just band-aid treating. They're just
Those
taking
are bad.
Xanax, and they're taking just that. They're surface treating a problem that can be treated, but they're just treating it in a way that's just, I call the band-aid approach. Throwing a band-aid at the problem, not actually fixing the problem. So there's a lot of people out there who are, that's all they have, and it doesn't need to be that way. And there's an answer to the problem. It's just and it's a chemical medical problem. It's not, people like, is it just in my mind or is it real? It's like, well, your mind is real. Your brain is an organ of the body, of course. And so people have this notion that this area of medicine is so different than every other area of medication, area in medicine, because of the fact that it just has to do with mood and stress, and that doesn't seem as real to people as blood pressure and diabetes and things that we can check blood tests or scanning or x-rays for. That seems to be more real for people because of the tests.
Hey,
Well, this,
suck it up. You can do this. Suck it up. Just suck it up and stop. And this was the approach I took. I was like, yo, fuck that. Don't be a bitch. Suck it up. What's wrong with you? What are you scared of? This is the approach I was trying to take. And tell you what, didn't work.
yeah, especially men. Men have the macho thing, and we can do it. Suck it up, and stop complaining. Don't be a pussy. That kind of stuff. That's men. Men grow up with that, and men don't cry. Men don't show emotion. And then so that's the problem is that when men grow up in that, they don't seek treatment. Like, women, like I said, are much more understanding. They understand that things change in their body. They understand they get PMS. They understand that they're going through something, and they're women are more emotional. Men are more logical in a sense. Not to being sexist here, but I'm just saying general rule of thumb is that women are much more likely to understand that there's something wrong that needs to be taken care of.
Yeah, it's definitely it's been hard, but I feel like I've been open to things, and I'm doing therapy, and I've cried in therapy, and I've cried in front of my wife and in front of my son, and it's like, well, if you think I'm a bitch, then come fuck me up. Come on, try it. Let's see how that goes for you. You're gonna have me choking you out, dropping tears on you. You know what I mean? I'm gonna put you in the rear naked choke and spank you as I cry on top of you. you know, it's just it's okay. It's okay. It's part of it. I was on the train on Sunday and I started crying because we went past Newark, and that's where my pops is buried, and it just hit me like a brick when we passed that station. I felt like I got, I hit a wall, boom, and it just, I didn't start like, I just some tears came out, and I just kind of bowed my head, and it is what it is. It's my pops. He's gone. You know what I mean? Like,
I cry sometimes. I mean, what makes me cry sometimes is when people share with me how they're feeling, and I sometimes I get teary when people say to me like, "Oh my God, you saved my life," and this and that, and it makes me emotional sometimes because people tell me
it's
like, "I
heavy.
never feel like this," and it makes me emotional when a patient of mine dies or something. I've this one a little older guy I've been seeing for years, and he passed, and the relative, the wife called me and just said, just let me know that he passed, and that he thought so much of you over the years. And anyways, she started talking to me about him and just wanted to know that this is how he felt about you. And I started crying because it's I knew this guy for so many years, and his passing just really hit me, and so I mean he was an old, very old guy, but it just really got me emotional when the wife was telling me about that and about how much I meant to him and how much I improved his life, and yeah, that's emotional stuff. What I do, I get that way because I deal constantly with people's emotions, and so when I hear success stories, it humbles me because because I really realize that this is why I do this. I do this because I love the results. I love seeing people's lives change for the better. And it still gets to me after doing it for so long. I still get that joy out of it, that pleasure out of it.
Don't never underestimate the impact these things make. I reached out to every person who helped me, especially in my youth. I found them as a grown man. Um, and they told me the same thing. They cried when I reached out. But I said, hey, listen, you saved my life. You kept me from going into this really dark place where I might not be here anymore. I legitimately was maybe not will be here right now. Um, yeah, so I wanted to make sure they all knew. There's only one I couldn't find is a gangbanger who kept me out of a gang by beating the shit out of me. He's dead, so I could never let him, thank him to say, hey, thanks for keeping me out of that gang, because, God knows where I'd be today. But every person, my counselor, the lady who got me to go to college when I was in a dropout program, like all these folks that helped, guys like yourself, y'all make a huge impact on maybe, I mean, not to get really dark, but a person could be thinking about not existing anymore. You know what I
Yeah.
mean? And it's a very real thing. And if you can help them get out of that, I mean, and save their life, I can't imagine that wouldn't impact you. It has to. And I presume the opposite. If somebody does, I can imagine that would hurt, because you feel like, damn, if only I had more time, or, so I think you're in a heavy field.
It is, but I thankfully I have a really good success rate, and yeah, normally the bad news is not nearly as common as the good news.
That's
But yeah,
good.
it's a heavy field because you have to be. I'm kind of an empath, so you have to be empathic, and because you have to feel people's emotion and listening to people's stories, and so. But yeah, so it can definitely be emotionally draining at times, but when you love what you do, like I do, and you love to help people, it's just it's worth all that.
Listen, I've kept you on for over an hour, and I want to thank you so much for your time. I thank you for letting me do this again. I was so upset. I was like, I'm just gonna write an article and
Okay.
break it down because I didn't have the video. But and your reps was like, just write the article. I think they were pissed at me. You know what I mean? I think they were angry at me, and I was like, I had messaged you on a couple social media, and they're like, we run his social media, just write an article. And I was like, no, I gotta find a way to directly talk to this guy. I can't. Clearly, they're trying to keep me from talking to him. So let me call the office, because I
If,
wanted to have this recorded. Like,
if you want to get a hold of me, my website is drpaulcoronamd.com. So that's DR for doctor, no period after that, and MD for medical doctor. So drpaulcoronamd.com, and that's the way you can get a hold of me. And I have my podcast, The Dr. Paul Show, on Spotify. I try to do that weekly, and so I talk about I just pick a subject and go with it during the show. It's just audio. And then I'm on Spotify. I'm on Spotify, but I'm on Facebook, Twitter, and Instagram. I guess now X. So if someone wants to follow me on social media, but yeah,
you active on those platforms as well? You post stuff, and I saw you post stuff on IG. I saw videos and stuff.
I do videos on Instagram. The videos also show up on Facebook. But yeah, but anyone wants to follow me there, and yeah, and if anyone wants to be a patient, just notify me. I see a lot of people out of state. We can meet up on Zoom. We can meet up over the phone, whatever's best. So
Awesome. Hey, dude, thanks so much for your time.
right.
I wanted to ask you if you had an appointment, but I presume it's best to do that through the staff, because it sounds like you have a big intake process to get all the details you require. So I'm presuming there's forms and things to fill out. So I'm
More.
gonna do it. Yeah, I'm gonna do that. And I mean, to me, even though I'm not working, right, and I'm on a limited income right now, $500 is a small price to pay to feel better, to take care of your health, physically and mentally. You know what I mean? Like
Yeah, it's less
It's-
less than that for 3 visits.
Yeah.
And yeah, but it's yeah, it's worth it. And yeah, I keep my prices low. I have for a long time now. I don't like to, because I know people are hurting right now with the recession and all that. You know, with the economy is not a good place right now for a lot of people. So try to be sensitive to that.
Yeah, well, we're grateful for that. You know, and I wish you, I look forward to you having a lot of success. I like Dr. Paul. That name is good. It's a good, like it's a good name to have as your, you know what I mean? Like Dr. Corona, it's okay, but Dr. Paul, I feel it just feels more welcoming and you know what I mean?
Yeah.
Awesome.
Corona is very well known now with the virus.
Yeah. Oh, I didn't even think of that, but yeah. I did think of that the first time we spoke. That did occur to me, like, that won't do you any favors. Although it could because it can mean you're an expert in it. So
Name recognition, exactly.
yeah. Awesome. Well, again, thank you so much for your time. I'm gonna request an appointment and
After I get you to that magical place, you can have me back on. We'll talk about it.
that'll be great.
All right.
Awesome. That's wonderful.
Sounds good.
All right.
Have a good one.
All right, I'll talk to you soon. Be well.
You are listening to the NYC Talking podcast. www.nyctalking.com. Please like NYC Talking on Facebook. Please follow Angel R Talk on Twitter and Instagram. We are NYC Talking, the realest lifestyle blog ever. Thanks for listening.